For some young people, when they present with depression, it will actually be the first presentation of bipolar, but that will only be made in retrospect. So the issue is, for a GP, is there anything unusual about this presentation that would make them think about bipolar? So does the young person have any history of hypomanic symptoms in the past? Do they have a family history of bipolar? Or is there something unusual about this presentation of depression? And if indeed there is a suspicion that this could be a bipolar disorder, then what should happen is a referral to a specialist mental health service for a comprehensive assessment. Bipolar disorder is a mood disorder that's characterised by episodes of lowered mood and episodes of elevated mood, or mania. The difference between mania and hypomania is that of severity. Mania is obvious, it disrupts a young person's life, and therefore it comes to attention. It's quite distressing. But hypomania can actually quite be missed. It can be missed because the young person doesn't see it as a problem. And so from a GP's perspective, you need to actually ask about hypomanic symptoms. Specifically ask young people, have they had periods of an elevated mood for 2 or 3 days where they felt euphoric or this fantastic sense of well-being? And did they have increased energy and feeling like they didn't need to sleep and they could do lots of things, often accompanied by a subjective feeling of racing thoughts and having lots and lots of ideas? And when that happens, often young people engage in behaviour that is out of character for them or unusual. And again, it's important to inquire, did they spend too much money? Did they engage in impulsive sexual activity that's, again, out of character for them? Were they drinking too much? Were they driving too fast? Were they using drugs? The key about these impulsive behaviours is that they are out of character for the young person and can be potentially dangerous. Other things to ask a young person is, how long did this episode last for? 2 or 3 days, a week, more than a week? Did anyone else notice? Did anyone else comment? Did mum and dad say anything, or a friend say anything? Because it might give us an opportunity to get some collateral history from someone else about what was the young person like at that time. And how did they feel afterwards? Because often, after a hypomanic episode, a young person can feel quite flat. A range of disorders in childhood can present with very similar symptoms: hyperactivity, impulsivity, distractibility. And these usually are not bipolar disorder. They are more likely to be ADHD, or a child who comes from a trauma background and might be hypervigilant or hyperreactive. So we need to be very, very careful about this phenomena of symptom overlap. When you meet children with these symptoms, what they usually lack in their presentation is that there is no sustained elevated mood and there is no grandiosity that would be there in bipolar disorder. However, if you're worried or you think this might be the case, then a referral to a specialist mental health service is very important.